Welcome everyone to the April 10th, 2024 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jennifer Maynard.
Jen Maynard, present.
Dan Finn.
Dan Finn here.
And Bill Muller.
Bill Muller here.
I know Austin is unable to attend this evening. And then I know Nancy most likely isn't going to make it. And so then I see Sarah Harris.
Hi. Yep.
Hello. And then Devon.
Here.
Right. So let me get back to my script. I don't know what is going on with my computers, but all right. I would like to open the meeting. One of the board members, can I have a motion to open the meeting?
This is Dan Finn. I'd like to make a motion to open this meeting.
All right. Is there a second?
Jen
This is
Maynard,
Bill
I'll
Muller. I
second.
second that.
And then roll call vote, board members.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski-Govin, aye. All right, good evening once again, everyone. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the act extending certain COVID-19 measures adopted during the state of emergency. This act includes an extension until March 31st of 2025 of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note that the meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything that you may be broadcasting can be captured by the recording. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Then just before we turn to the first item on the agenda, I'm just going to cover a few brief ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. For any topics on the agenda, I'll introduce if there are any speakers for said topic. After the speaker concludes their remarks, I'll invite the board members if they have any comments, questions, or motions to make. Please identify yourself by name when speaking, and then please mute your phone or computer when you are not speaking to reduce background noise. And then please remember to speak clearly and in a way that helps generate accurate meeting minutes. And then finally, any votes on any motions made during this meeting will be conducted by roll call vote. So all of that being said, let's see, just want to make sure I saw someone else. Someone calling in to listen. All that being said, the first topic on the agenda is the Alliance update. So I don't know, Devon, Jennifer, Sarah, who wants to go first?
I'll go first. Good evening, everyone. I'm Devon. I'm the health inspector for the town of Grafton. This month, since the last meeting, we've had, and I do apologize, I don't know the exact number, 10 or more food inspections. We've only, this month, we've had 2 complaints, which is nuisance complaints. And right now we're just gearing up for the spring season. So we're going to be doing pool inspections, more mobile food truck inspections, and camps. And that's all I have to report at this moment. Any questions?
Not seeing anyone raising hands or off mute, so
Okay,
I'll take that as no. Thank
thank
you.
you.
All right.
I will go next.
All right.
I'm Jennifer Nachjova. I'm the Chief of Community Health for the Worcester Division of Public Health. The only update I have is in regards to the shared coordinator position that was leading the opioid prevention work. That position closed a few weeks ago. Starting tomorrow and Friday, they'll be interviewing for that position. So once somebody is hired, we'll let you all know who that person is. But, wanted to report that we're actively interviewing for that position to have somebody in that position as soon as possible. So,
Happy to hear that.
yeah, and I think the other thing for Grafton to report on my end is the school district has resumed their school committee meetings as of last month, and they have several meetings coming up, and we're part of that effort. And I think it's exciting for us to have them back at the table, and having these meetings are really well attended by parents, youth, and other school officials. So in terms of prevention work, I think that we are forming a great foundation within the schools currently. And I did communicate the other efforts in Grafton that they could be part of, and I'm hoping that they're able to attend some of the other efforts that this group is part of as well. So that's it for me. Any questions for me?
No.
Um,
Oh, Dan, snuck in.
Yeah, Jennifer, just one, will you be posting things on the Grafton website, town website, as well as the Worcester Alliance, as far as any events and things?
Yes, my hope is that once we have somebody in the shared coordinator position that was previously held by Karina, that person will be able to do that. In the meantime, I'm happy to also make sure that happens until that person starts. So to
Sure.
post things on the Grafton website and the Alliance website as well. So I'll follow up on that.
Great, thanks.
You're welcome.
All right,
And to
and
finish-
Sarah.
To finish it out, short and sweet, just like the two of their spiels as well. Not much change, just a actual decrease with the amount of flu and COVID that has happened throughout Grafton, pretty much in half, which is good to see and not really surprising the time of year. And no reported FBIs, as Devon would have reported on. And then as far as the topic of the month goes, we're going to start with tick-borne illnesses, because with what little nice weather they do share with us here in New England and here in Worcester, people will like to take advantage of it. So we want to kind of get a jump start on education on tick-borne and mosquito-borne illnesses. So that's the health topic of the month, starting this month. So any questions for me?
No questions. I've thought the same thing. I'm like, oh, pretty soon we're going to be talking about ticks and mosquitoes. Yeah.
We already thought of it. We thought of it a couple of weeks ahead of you, I guess. So
I'm like,
So
oh,
if
should
you
I put
have-
that in my notes? I'm like, well, it's not the season yet. So
not yet. But if you
Yeah.
do have pets, as I think about it right now, as I can hear my dogs running around, if you have taken their flea and tick collars off for the winter months, time to put those back on as well. So I'll throw that in there as well for a little tidbit for people who might be listening.
They're already here because of the warm weather, so.
Stop
we-
scratching, stop
I
scratching.
know, you're making me itchy because I've actually already seen one.
Oh,
this
no,
year,
no, no,
so
no, no.
they're-
Okay, so perfect timing with this meeting. Sorry, folks, it was a little later than usual.
Get on that flea and tick if you don't do it year round.
Exactly. Any other questions or comments, concerns? Perfect, thank you.
If I may add something, Karen,
Yeah,
which I'll send out to you to share with everybody. April 11th to the 17th is Black Maternal Child Health Week. We do have an event happening at the City Hall in Worcester on April 16th. Just really trying to shine a light on some of the disparities that do exist in maternal child health for Black and Brown birthing mothers. It is something that I think Worcester is looking to spearhead when it comes to health inequities for that population. So we have an event happening on the 16th. UMass has other events happening too between the 11th and 17th. So I'll be happy to share those events. You can attend in person and virtually. So I'm hoping, I know we all have full-time jobs, so if you have an hour here or there to just log in, I think we have a great panelists that are presenting on that day, from the commissioner of Health and Human Services in Boston coming to that event. So I will share the flyer and other information. I'm hoping that some of you can plug in and just learn more about some of those issues that we are tackling.
Appreciate you letting us know, definitely. Right. Any questions, board members, or anything else for the Alliance folks? Okay, then we will jump into it. COVID-19 updates, really, I think, we already kind of touched on with Sarah that thankfully the cases, not unsurprisingly, are been coming down along with flu given the season. That being said, obviously, there's still the concern around certain populations, especially just because we're starting to get into nicer weather doesn't mean that it all disappears and everyone's immunocompromised status or whatever just magically disappears just because the weather is starting to get better and we get to go outside more. So just a reminder for the populations or those who have family and friends and close people that they're close with, or live with, etc. Like, just continue to be mindful of precautions if there's any type of vaccinations to catch up on, etc. And then Jen Maynard, I see your virtual hand up.
Virtual hand. I just wanted to flag, in case people listen to this later, just to acknowledge there's been like updated CDC guidance around isolation protocols and things for COVID. But I think one of the things that's really important to remember around any respiratory or other type of illness is sort of that being fever free for 24 hours or more without things that lower your temperature, like Tylenol and Advil and things like that. So when anybody is sick, if you have a fever going around people, you can still, as we all know, transmit illness without that fever, but really that being fever free and not needing medications is a big thing the CDC is sort of reminding people about, to just be mindful when they're going out into larger crowds and things for any kind of spread of illness. So
yeah, and I noticed with that when I looked at it, that once they had updated CDC, it's not, because I'm like, where's the COVID you get so used to for years now? Where's the COVID specific guidance?
Exactly.
And
Yeah.
restrictions? And I'm like, am I going to the wrong place? I can't find like COVID specific. And it's like, well, it's upper respiratory infection
Exactly.
guideline. I'm like, okay, after like 6 different ways of trying to find it, I finally resigned myself to the fact that I was actually at the right site, not like
I'm glad I wasn't the only one, Karen.
I've heard it somewhere else. And I'm like, okay, this is the right place to be now.
Yeah.
So yeah, so
and
just anyone who is listening, if you're looking for COVID specific, we can tell you at this point in time, from trials and tribulations trying to find it, it's not COVID specific anymore. It's upper respiratory, so flu, et cetera, not just COVID specific.
Right. And I think, one thing we've learned over this time, especially as, vaccine have become more available, people's cases are maybe not as severe as they once were, is that those things that we learned about good hand hygiene and masking when you're not feeling well are good practices to have, listening to your body. And it really, at this point, it could be the flu, it could be strep, it could be any number of those things. But just practicing those good techniques.
Yeah, it brings back, back in the day, no one, at least in the US, typically most people weren't, if you had the flu or RSV or a cold or anything like that, or any other random virus or upper respiratory thing, no one ever wore masks unless you were maybe like in the medical field and you wore it in your practice when if you were in practice not feeling well or something. Nowadays, it's like the total opposite situation, where it's like we get all, for the most part, got used to it and stuff. But it's just how times changed when,
little bit more accepted now. If you know, if you're not feeling well, to be wearing a mask in public, or if you're compromised and you're concerned, like that's fine. And I think Sarah, great point. You know, vaccines are still available, even though we're coming off of flu season. Vaccines are still available for flu and COVID. You know, and you know, if you were somebody that got your vaccines before for flu and COVID, it's good to do that. If you're somebody that doesn't, you know, just follow the same things with keeping yourself and others well.
And the
Exactly.
reminder also with the RSV vaccine for the populations, while we're on upper respiratory,
That's
we
right.
have the
And the
RSV vaccine for specific populations also that is out there now, that's available at pharmacies, et cetera. And then I saw Dan's been feverishly there with his hand.
No,
Yes,
old-
Dan.
Old school hand up. So anyway, yeah, I just wanted to mention that Nancy and Beth do have COVID-19 tests available. They actually have an expiration date of the end of 24. And as we know, they're generally good for a year, at least after that, but they are available if anybody wants to pick up a couple or a few.
All right. There is nothing else with COVID, et cetera, and anything else upper respiratory at this point. We will jump over to opioid settlement funds. So Bill, Dan, I don't know who wants to kind of cover this, kick it off, whatever the case may be for status update. Since we don't have, you know, in here anymore to sit there and say, okay.
Well, I guess I'll start. This is Bill Muller. We did receive via email yesterday an updated document that was basically created by the Alliance, making some broad recommendations regarding how best to utilize these funds. We haven't had a chance to talk to Dr. Wong about it, but I think in general, it takes advantage of our pre-existing relationship with Worcester, Shrewsbury, and West Boylston to come up with a collaborative approach. It does talk about hiring a specific person for a position of opioid. I forget how they refer to it. It's opioid
Prevention specialist.
prevention, right. It's a little unclear to me what the relative expense would be to us versus the other towns. But I do think that in fact, from the beginning, we thought that it would, the amount of money we have is not so large that we can do much on our own. So I think conceptually it makes sense to take advantage of the possible collaboration with other members of the Alliance. But I think it also makes sense to try to augment some of the things that are already in place, including some things the chief of police has referred to in terms of counselors that get involved if the police come across somebody who has been identified as somebody has opioid use disorder. And we actually did meet some other people at our last meeting that were also kind of counselor sort of people who were charged with providing some counseling and some referral to people in terms of intervention or treatment. So I think we have made some progress. The document is actually quite lengthy. It clearly didn't come from Dan or me. And I do think is in a format which I think we can present to other entities in terms of how best to proceed. one of the things that our last alliance or our last opioid task force committee is we had an attendee who was a mother of somebody who had struggled with opioid use disorder. And fortunately has appeared to be able to overcome that, although she, as the grandmother of this person's son, is actively involved in raising her grandchild because of some of the effects of this sort of behavior. And I do think it would be helpful, and I'm hoping that she will attend other meetings to both make us aware of things that she has found, because she's obviously been dealing with this for quite a long time. And what she has found helpful and what we might want to continue to support or augment. With that, I'll stop talking, Dan.
Okay, no sweat. Yes, and I think the proposal that was presented and is on Evan's desk, I mean, I don't think we get to decide necessarily, but he'd be looking for our input as well. Generally, I think it's a good idea. They're basically looking for 40% of the proceeds that come to the town of Grafton to put together to collaborate, but the majority of that, besides some of it paying for the specialist salary or whatever, would go to the town of Grafton. Shrewsbury apparently is all on board with it, and I don't know for sure if they've agreed to a 60% donation to the funds, to the collaborative funds, and I don't know if West Boylston has decided yet. But it does make sense to me to get some general direction and not duplicate things, and to be able to, whether it's an event to present to all three towns and again, collaborate our ideas and brainstorm together. But again, if anyone has any concerns on the board, you can ask Bill or I. If we don't know, we can talk to Ian and get some answers. But I'm pretty sure he'll be the final decision maker on that agreement. So I don't think we have to take a vote, in other words, at this point.
If I read it correct, I think what we saw is pretty comprehensive, as you said, for the proposal, actually, which is awesome. Am I understanding it correctly that this potential proposed sort of position of the prevention specialist, might be somebody that helps get the word out there about different services available in the communities, and also helping to connect people? Maybe that person has a phone line that they would call, and I know there's like the overall state phone lines, but these are more local in our trenches and can refer to services that are right here and be sort of an expert on those services available in our communities. Is that the plan?
As far as I know, that's the idea, is to have them connect people and keep the communication going.
That's great.
I mean, one of the things that the people who were at the last meeting point out, though, is the issue of insurance becomes a huge issue when you're trying to refer people for detox or other substance use services. Because a lot of the insurance plans have either carved out coverage for this, or at least have some limitations of coverage. So they alluded to the fact that they'll call places like Spectrum House or other places that are in the business of doing substance detox and things of that sort. And the ability to get somebody accepted there is very much influenced by what their insurance is.
Yes, and also, interestingly enough, the other big roadblock that they run into is transportation, trying to find a way to get that person to the rehab facility. And they've gotten gift cards and for Uber and various things, but that's something that we could all look into.
Yeah, I might have some ideas to share about both those things.
Great.
Yeah, based on some past experience with my work life. And it looks like the sort of contributions, I'm assuming, is kind of based on population within the town.
Right.
Within the, yeah. Just looking at the share of how we would kind of propose to break that up. Okay. I think that's great.
Yeah.
Exciting.
It's a little
Nice job.
unclear though. This is Bill Muller again. The Shrewsbury gets more money than we get. So if they're paying 60%, we obviously get more than Boylston. So it's a little unclear how that number
Hmm.
is arrived at. Are we giving 40% of what we received? And they're giving 60% of what they received, but of course they received a larger number. So I don't know.
Sure.
Yeah.
Or they would contribute 60% of the total cost for this
Right,
position.
it
Yeah.
really is a little ambiguous about.
Yeah, yeah. So we might, so to that, your earlier point, then, within the community, we might say, we'll have a pool of funds to help with transportation, offset transportation costs for people,
Right.
for example.
Right.
That's
Yeah.
good that it wouldn't necessarily be all of the funds, and we could do other things to
Sure.
directly get people places.
Yeah, and that's a question Evan might have as well, just exactly what the breakdown is, and if it's on an annual basis or what's already been, I think we already have like a year and a half worth of funds. So anyway, those technical financial questions you can look into, I think.
Jennifer N. with the virtual hand.
Sorry, I was just going to say that I know the fact that Ian will be working with different towns to come up with a number for each town. And yes, Shrewsbury does get more money than other towns. So he will have a breakdown of what makes sense per town to contribute, like looking at the population as mentioned earlier. So I know that he's actively working on putting those numbers together, and that would accompany the document that he sent out. So
Great.
folks have a clear understanding of what the ask is.
Thank you. And yeah, I know from the whole insurance piece of the puzzle, not personally or anything, but I know someone who used to work for one of the substance abuse facilities in the area, and they actually did insurance, the billing side of the world and stuff. And yeah, it's all over the place. Is it outpatient that they're trying to get? Is it inpatient that they're trying to get? Who's the insurance? What, even if it's something like it's Blue Cross, well, which Blue Cross? So it's like everything we deal with insurances. But just the extra additional piece of the puzzles that go along with it from a substance abuse perspective versus just a, hey, you need an MRI type of situation. So it didn't sound like fun on the receiving end trying to figure out how to do all the billing and stuff either, let alone the people who were trying to actually get the services.
I mean, I think one of the problems is that people are often very resistive to even considering treatment. And if they get to the point where they now accept it, to have it derailed by things like insurance coverage and things of that sort is obviously extremely unfortunate.
Yeah.
To that end, Jennifer, I don't know if you folks are already working with, BSAS, if they can try and make some like En-ROADS within the state. I mean, Massachusetts is usually, we all have, challenges with connecting, but I wonder if that's something we can try and work with at a bigger level if we haven't already.
We are, all our prevention grants are through BSAS, youth prevention work is through BSAS, but I know that our commissioner works monthly with BSAS as well. Like I think like the long wait lists are an issue all around, right? If I'm at a point whereby I'm abusing a substance and I'm ready for services and I have to then wait for that service. I think that's has been feedback all around in terms of just having to wait to get those services.
Right.
It continues to be a barrier for most folks. Yeah, so I think, I will make sure that Ian is aware in terms of like maybe getting some input from BSAS as well to see what are some of the things that they have going on to kind of like overcome those barriers across the board, for sure.
Great.
Anything else on this topic?
I did want to ask about the Narcan training that happened under this same umbrella, the opioid committee, and how that went, and if that was effective for folks in Grafton.
Dan?
Yeah, I think there were probably, Bill, you might know better, 10 or 12 folks there. Unfortunately, we didn't get the advertising out effectively as soon as we wanted to. But the folks that were there enjoyed it, and the speaker did provide not only good instruction, but also some Narcan kits. She still has them at the town hall. She's going to get them around to people that want them in the town hall. And there are some there if anyone wants to secure a couple.
Yeah, I picked up 2 kits, and one, the instructions are in English and the other, the instructions are in Spanish. I'll try the English one first.
It's never too late to learn a new language. But
Yeah, I know.
I bet they'll both work the same if you use the.
Yes,
English
yeah.
one.
That's certainly my hope and expectation.
It's not like the COVID kits where you get like, I remember the first time I opened up one and I was like, out came the Spanish version first. And I'm like, I mean, I took a lot of years of Spanish, but I'm a little rusty, especially if I'm going to be trying to do a COVID test. I really want to make sure I'm following the rules to a T. And then I'm like, I dump out the rest of the box. Well, oh, they're the English ones.
Well, all of those were, in fairness, all of those, every kit was, no 2 kits were the same, right?
It was just like, did they forget the English version? No, oh, there they are. Not something you want to mess around with. All right. If there's nothing else on opioids, then we will jump over to a few nominations that we have. These are annual types of nominations. Just a reminder, since we only do these annually, typically, unless someone was to leave in between during the cycle, there's, for each individual on here, there's 3 of them related to animal inspector positions, motion by a board member, second by a board member, and then roll call vote for each of them, not as a group. So the first one we have is Melinda McKendrick as animal inspector. Dan?
First of all, the question, we're nominating them and then the selectmen appoint them, is that correct? Yeah. Okay, so I'd like to make a motion today to nominate Melinda McKendrick as animal inspector for the next year.
Jen Maynard will second.
Roll call vote.
Dan Finn, aye.
Jen Maynard, aye.
Bill Muller, aye.
Karen Gwiazdowski, Dovin, aye. All right, and then Jay, I always mess up. I don't know if it's Huson or Huson. I apologize, Jay. I only say it once a year. Dan?
Dan Finn, I'd like to make a motion to nominate Jay Husson, I believe, as animal inspector for the town for the next year.
Jen Maynard will second that motion.
Roll call vote.
Dan Finn, aye.
Bill
Jen
Muller,
Maynard,
aye.
Karen Gwiazdowski, Dovin, aye. All right, and then Keith Elms for assistant animal inspector. Dan?
One more time, I'd like to make a motion to nominate Keith Elms as assistant animal inspector for the town of Grafton for the next term of the year.
I'll second that.
Roll call.
Dan Finn, aye.
Bill
Jenny
Muller,
David.
aye.
Karen Guzowski, Govern, aye. All right, thank you. Then the next and final topic on the agenda is a recommendation to the select board that they renew Colleen Driscoll's contract as the Tufts biomedical consultant. Similar situation, recommendation. We're not like actually, signing the contract or anything. So this is just the recommendation to the select board. Same setup though, motion, second, roll call vote.
Mr. Finn.
This is Dan Finn. I'd like to make a motion this evening to recommend to the select board that they renew Colleen Driscoll's contract as the Tufts biomedical consultant for the, I think that's for the town.
Jen Maynard, I'll second that motion.
Roll call,
Dan Finn, aye.
Jen Maynard, aye.
Muller, aye.
Karen Guzowski, Govern, aye. All right, thank you. And now minutes. We're almost done with all the catch up of the minutes. We got 1, 2, 3, 4, 5, 6, 7, and we have to pass over one that we didn't see, the last one. So first one up is June 3rd of 2019, which we didn't have Jen or
can't.
Bill.
No.
Right. So I think we have to pass on that.
Pass
make-
that one. Same thing, December 30th of 2019.
Correct.
August 6th of 2020. Bill, you were on the board, I think.
Maybe.
Yeah,
I think so. Actually,
I know
think
Jen was not, but
I was not.
Jen was not. I think I was.
You would.
all right. So we tabled the June 3rd, 2019, December 30th, 2019, August 6th of 2020. Dan,
Dan Finn, I'd like to make a motion to accept the minutes of the Grafton Board of Health for August 6th, 2020.
there a second?
This is Bill Muller. I second that.
All right, roll call vote.
Aye.
Bill Muller, aye.
Karen Gustowski, Govin, aye. All right, then December 1st of 2020. Which I also don't think, Jen, you were on yet.
The next year, the next summer, I think it was.
Dan,
Dan Finn, I'd like to make a motion to accept the minutes of the Grafton Board of Health meeting from December 1st, 2020.
second.
This is Bill Muller. I wanted to second that.
All right, roll call vote.
Dan Finn,
Bill Muller, aye.
Karen Gustowski, Govin, aye. All right, February 8th of 2021. I don't think so. Yeah, I was like, we're getting closer, Jen.
I don't see that one on my list, but I remember going through them all. Anybody else have that?
Yeah, I
wants-
do.
That wants to make a motion.
I guess I can make the motion.
Sure.
This is Bill Muller. I want to approve the minutes that we just noted.
Is it February 28th?
2021.
Right.
So Dan Finn, I'll second that motion.
All right, roll call vote.
Bill Muller, aye.
Dan Finn, aye.
Karen Wasowski, Govin, aye. All right, September 13th, 2021.
I'm in.
Woo! Dan,
This is Dan Finn. I'd like to make a motion to accept the minutes of the Grafton Board of Health meeting on September 13th, 2021.
Bill Muller, I want to second that motion.
all right, roll call.
Dan Finn, aye.
Bill Muller, aye.
And Maynard, aye.
Karen Gustowski, Govin, aye. All right, and then February 5th, 2024. Dan,
So Dan Finn, I'd like to make a motion to accept the minutes of the Grafton Board of Health meeting held on February 5th, 2024.
Bill Muller, I want to second that motion.
all right, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
And Maynard, aye.
Karen Gwizdowski, Govan, aye. And then the March 4th of 2024 didn't come through in time, so we'll table those until the next meeting. All right, and there's no additional mail or correspondence that I recall. Dan, now if you want to give a quick update under old/new business around the Tufts Rabies Clinic.
Yes, I guess it was successful. Again, it could have been more successful if we were able to get the advertising out, because there were only a few patients, and but there was quite a crew from Tufts, and they all had a good experience, I think. And it was, I think the town clerk did provide a couple of dog licenses, and they got their rabies tags and all. So I'd say it was successful. But next year, we hope we can get more advance notice out to the general public.
Yeah. That's awesome, Dan.
Yeah.
People were very excited when I dropped by. They're like, oh, this is a great service to offer. And so I think to your point, once we get a commitment, the more we can kind of get it out there. I think certainly folks on a fixed income like seniors can benefit from that.
Right, and I did take some pictures. I'll try to get to Nancy and see if William is able to get up on the website, just that we had it. Early advertising that could happen coming again next year.
There you go. Yeah.
So,
But that's great. It's a great offering.
Yeah.
We all love our pets, right?
Mhm. Agreed. Yeah. All right. I think I already touched, I was going to mention the RSV vaccines as a reminder, but we already touched upon that in the COVID/upper respiratory infection world. So if there's nothing else old new, then we can get into the upcoming meetings that we have. We have May 6th, which is currently scheduled as like a hybrid meeting. And then the rest of these on the list are all remote currently. So June 3rd, July 1st, August 5th, September 9th, October 7th, November 4th, and December 2nd. All right.
just one last question, Karen, in that regard. Are we okay as far as the state goes in terms of having remote meetings? Does that continue through 2024?
March 31st of 2025 currently.
The deadline, all right, okay, thank you.
I doubt they would revert to earlier. If anything, they've been pushing it later. So. All right. There a motion to close or? And
I've got to figure out how to do that remote hand. Anyway, this is Dan Finn. I'd like to make a motion to close this meeting.
Roll call vote.
Dan Finn.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski, Govan, aye. Well,
Very
thank
good.
you, everyone.